live life. We only have one life, and as you just mentioned, you had a second chance in life, and you're going to live it. Um, let's go back to the topic of, can I use CBD or cannabis with chemotherapy? And how do you approach this conversation with an oncologist who is anti-cannabis? Because this happens all the time. I don't want to bring this up to my doctor, but I feel when this is your health, and you should share everything that you're doing so the doctor knows, okay, we can make some certain tweaks here. Because a lot of doctors will say, okay, patient X, if I find out that you're using cannabis, I'm going to have to ask you to get another doctor. And so a lot of times they say, great, it happened to my aunt. She fired her doctor. She went to someone else.
Yeah,
So
some doctors have that. I mean, it's so ridiculous. It's so
but I
ridiculous.
would share with families here in California or throughout the country, legal state or illegal state, it's not illegal to have that conversation. And if your doctor doesn't know this knowledge, say, can you recommend a doctor that would? Which is why you get a lot of doctor referrals, not only here in California, but throughout the country. Say, I don't know about cannabis, but here's a doctor that I've worked with or I feel confident recommending you talking to regarding this. So with cannabis, can cannabis help with chemotherapy in battling the cancer, not only with nausea, appetite stimulation, mood, and pain relief?
Yeah. So as I look back upon the last 5 years since we've gone to this multi-molecule, multi-oil concept, it's actually a very, very, very simple idea. If you go back to the plant from hundreds of thousands of years ago, it had CBD, THC, THCA, CBDA. All of these were about 1%, 1.5%, but they were all about equal. And the two most common were CBD and THC, which then meant CBDA and THCA, but at much, 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 much lower concentrations than we have now. But which direction did you want me to go on this, John, again?
Take the fork in the road.
Take the fork in the road. So I would say we started doing dose stuff 9 years ago. And I'd say about 7 years ago, we were starting on, if you look at a hill, on one side of the hill, we were looking what is going to help people with their nausea, with their appetite, with their pain, with their anxiety, with all the issues related to symptoms related to cancer and symptoms related to chemotherapy, including is there a way of preventing neuropathy with chemotherapy? And there is. I mean, we'll talk about this at another time in great detail, but CBD, whole plant CBD, at a dose of 30 milligrams a day, plus or minus, will, in the vast majority of patients, prevent them from getting neuropathy. So that's one huge benefit. One, not to get the neuropathy, but two, I've seen a number of patients that are using a neurocytotoxic chemotherapy and they're developing neuropathy, but the drug's really working and their cancer is going away, but the doctor then had to stop because that neuropathy, people would rather, it's called suicide pain. It can be really awful. So we've come up actually with treatment that's transdermal for the pain, but it's much better if you're using the CBD, you're going to be able to tolerate the chemotherapy better and you won't get neuropathy, which is a big deal. The other thing before we go into the nausea and the more routine things is that CBD has recently been shown, and it's at least 2 studies, and I think it's 3 or 4 studies, that with different chemotherapy agents, CBD prevents the chemotherapy agent from losing its potency.
Wow.
Yeah, because if chemotherapy didn't become resistant, things would be way, way better. So honestly, just for that one reason, people should be taking cannabis, and it's preventing neuropathy. And the acid molecules and THC are all helping with nausea, appetite, sleep, the early morning awakening that people get when they start feeling anxious during the day. This keeps you asleep more. I have people kind of double the dose an hour before their chemotherapy or radiation, because to be a little stoned when you're getting chemo or other IV drugs, I can personally from personal experience now, it is way better to be a little bit medicated. And it personally, I mean, I tried the standard meds, including pain meds, including narcotics, because I was having a lot of pain. I mean, a lot of pain. And I really didn't want to be on the narcotics. So I stopped. One day I was having excruciating pain, and I was seeing a patient, and I was up at the board. I was standing up in front of it, and all of a sudden this hip pain came in that felt like a knife was stabbing it. And I thought, how do I keep myself together with these patients that are in the room? And I just guts through it. And afterwards, I talked to my office manager, Alex, whom you know very well, who's like a third son to me. And I just took a pretty good dose of THC. And in 30 minutes, my pain was gone. I mean, I was going to call my doctor for some other pain pills. And why would I not want to reach for THC more? But you know what? Even I was assuming that it couldn't help this pain. This pain is so bad. There's no way. And I hope everybody's going to be okay with it, but I'm going to need narcotics for this pain. I've not used one narcotic pill the whole time. That's not true. That's not true. I tried one, and it didn't help me, and it made me sick. So, and I used to love narcotics, by the way. Any excuse for narcotic was, but THC is better at pain when it's really severe pain, and for a lot of the pain is inflammatory pain, and THCA, the raw form THC acid, is turning out to be the treatment for arthritis. And what I'm doing now for more and more patients, and especially the chemo patients that have inflammatory process as part of their chemo, the CBD and THCA are important. And it turns out for all these people, these 4 molecules help the nausea, the vomiting, appetite, sleep, anxiety. And on the other side of the mountain, we were looking at what's a good dose for having an anti-cancer effect. Turned out to be the same dose. Now, I'm not saying that we have the dose to treat cancer. What I am saying, though, is I have no doubts that what we're doing is real for both on the symptom side of the mountain and the cannabis and the cancer side of the mountain. And if the same dose, which makes sense, works for both, then what's the argument? What possible argument could somebody have?
Hi, John Malanca here with United Patients Group. I hope you've enjoyed our videos. Please click like as well as subscribe to our channel here on YouTube. Also, follow us on Twitter at Patients Group and on Facebook at United Patients Group, as well as for our podcast. Please click the link in the description below. We'll see you there. Bye-bye.